I'm Tom Testa. Today we'll be talking about the Trusted Dynamic Registration and Authentication Accreditation Program, or TDRAAP. Joining me for this discussion on TDRAAP and its impact on the healthcare industry are members of the partnership behind this new accreditation program. They are Lee Barrett, Executive Director and CEO of ENAC, Julie Moss, Founder and CEO of EMR Direct, and Louis Moss, Chief Technology Officer of EMR Direct. Well, let's get right into our discussion and start by talking about what TDRAAP is. Julie, let's start with you.
Certainly. So TDRAAP is a new program that incorporates both a technical testing component and a privacy and security accreditation component. It's designed by the UDAP.org team along with ENAC in a collaboration to meet the needs of the industry, both where we are today and in the more secure environment that we're pursuing in order to shore up and harden API ecosystems in order to allow patients that real democratized access to their health data that they're seeking more and more today.
I think, and Tom, as Julie went through it, I think the privacy and security aspects that she was mentioning, what we've done as part of that, the privacy and security, we've incorporated as part of that privacy and security, HIPAA, high-tech, ARA components. We also include the NIST, the National Institute of Standards and Technology 171, the 853 and 866 versions, along with the cybersecurity framework that they also included. And we also include the General Data Protection Regulation, GDPR provisions as well. So it's a very broad-based, very comprehensive as well review on the privacy and security aspects that we've incorporated into this program to really make it not only comprehensive, but also as easy, simple, and certainly to go after the objectives and the value proposition that Julie outlined.
Excellent. Now, Julie, back to you for a second. Why is TDRAAP important to the industry today?
The reason the industry, I think, is receiving the TDRAAP program so well is that it's formulated to meet this need that layers on top of the free standards like the UDAP.org profiles, OpenID, Connect, and OAuth, and of course, FHIR, a layer of confidence in this certification or accreditation option that really lets servers in the ecosystem be more confident about their users, clients, and identity providers, and vice versa all the way around. So an entire collection of participants benefit from the mutual confidence that participating in a UDAP workflow, and specifically one that's been validated by a third party like ENAC, allows them to achieve.
So this really focuses, just additional to what Julie's saying, really focuses on providing the level of stakeholder trust that organizations are looking for. Whether it's a health plan with all their various stakeholders in which they're performing in these APIs, these application program interfaces with, or health systems, really a variety of different stakeholders that are really working on developing APIs and are using these APIs. They're really looking for this level of stakeholder trust on not only the endpoints, but authenticating these entities. And the privacy and security aspect, therefore, becomes important as well in being able to validate this level of privacy, security, and the stakeholder trust. I really think that the industry is really trying to get to as we're looking to implement all these various APIs in the industry.
Hi, Louis. This next question's for you, and we know there are two program options available: TDRAAP Basic and TDRAAP Comprehensive. Can you tell us what the differences between the two are?
Oh, sure. So the TDRAAP Basic program is targeted at consumer-facing apps using your basic OAuth flows with the UDAP enhancements. So the typical app that a patient may use to access their data. The comprehensive program is more general and covers a broader variety of targets, including the servers that are providing the data, as well as applications that might be used by providers that have deeper access into clinical data for more than one patient, either using standard FHIR or bulk FHIR protocols, and also for identity providers that might participate in the federated identity supported by UDAP under the program.
Great, excellent. So Louis, let's take a little bit of a deeper dive here into exactly what's being tested and maybe even expanding a little bit more about the programs you just discussed.
Yeah, so we do have an entry path for apps that are following the basic OAuth 2.0 requirements as described in the ONC regulations and CMS final rule. And then from there, you can move up to more advanced flows, including UDAP registration and JOT-based authentication.
The next question here is, are there any organizations in the program right now? Lee?
So what we're doing, Tom, is we have 4 organizations that are going through the beta process. A couple of things, and I'll go through those organizations in a second. So what we've done is we went out for a 60-day public comment to the industry, asking for feedback on the program as we outlined it, and we got some feedback from the industry, which really just ended about a day ago. And in addition to that, we started the process with these 4 organizations. We usually like to do a couple of things. We've put together a steering committee that we have, a TDRAAP steering committee that's really representative of a number of different organizations and stakeholders that we've gleaned some of their requirements from and incorporated. Mm-hmm. And then the beta organizations, and the 4 beta organizations, One Record, QVH Systems, One Up Health, as well as Z Omega, are the 4 beta organizations, and all of them are in the process of completing the certification accreditation process for them. And so they've also been providing us with some really great technical feedback and operational feedback. Some of the technical aspects, Louis, as far as the development team, have been taking and are continuing to enhance the program. And some of the operational aspects we're taking, and we're continuing to refine that process, so that when we do look to roll this out, and we're looking at a rollout to make this available publicly in the first quarter of 2021, then we will have taken all of that feedback, enhanced the programs, and we're really going to look to continue to get feedback from the industry. And so if we need to make further refinements, we will look to do so. We'll continue to keep our steering committee informed and involved in giving us feedback. So this is going to be an ongoing process as we look to refine and continue to meet industry needs and requirements. And we've got a great partner in EMR Direct to do that. And so we're going to continue to focus on making sure that this adds the value proposition that people are looking for, and really is providing the types of benefits and the alignment from an interoperability perspective.
Great. Now, how can organizations, you talked about the beta organization, but how can other organizations learn more about the programs?
So we've created a number of documents, brochures, and other informational documentation that we think people will be interested in, that will provide an overview of the value proposition, what the programs are, as Louis outlined, for both the basic and the comprehensive. And people can go on to ENAC, www.enac.org, and go to the program on Trusted Dynamic Registration, Accreditation, and Authentication Program, TDRAAP, and there's a whole lot of information there and resources that organizations can download, take advantage of, as well as they can see the entire program and see what they need to do to go through and make application and go through the entire process. So the intent is to make this very transparent, easy, and we look forward to organizations going through it, making application, and really adding kind of that level of stakeholder trust that we think and we've heard from the industry that they're looking for.
Great. Well, Louis, Julie, Lee, thank you.
Thank you, Tom.
Thank you.